All right, ladies, are you ready to get started?
Yes.
Yes.
All right, I'm gonna stop sharing my screen and Noelle, I'll let you take over.
Okay. Great. Hopefully everybody can see that. Well, welcome everyone. We're getting started right on time. Thank you so much for being here today with us, joining us on Facebook and also on Zoom. My name is Noelle Fields, and I'm an assistant professor here at the School of Social Work. It's my great pleasure to moderate today's panel. We have a wonderful group of faculty panelists today. And thank you to everyone at the UTA School of Social Work for making this special event happen. The focus of this panel is on COVID-19, diversity, and health disparities. It is important to underscore that health, mental health, economic, and service access disparities are all fueled by racism and systems of oppression. We have seen the consequences of white supremacy and anti-Black racism over generations, and specifically in the murders of Black men and women by police. COVID-19 has intersected each of these domains, exacerbating existing disparities while simultaneously reducing access to the communities and services that are part of responding to disparities and creating equity. Today, we will focus on the intersections of racism and COVID-19, seeking to equip students and community members with data and information to support action and advocacy. This first presentation will be followed by 2 additional opportunities for learning and engagement. A second panel presentation will focus on the practice community's response to COVID-19 and social distancing, with an eye toward how these responses can promote racial equity. We will also have a third town hall style event for discussion and further processing of these topics. Please follow the UT Arlington School of Social Work social media pages for the latest information on these upcoming events. Before I introduce our esteemed panelists, I would like to go over a few logistical items. All attendees will remain muted throughout the session, but you can enter comments in the comment section. We will not answer any questions during the panel, but we will reserve the last 30 minutes of the presentation for your questions and answers. Zoom attendees, you can enter your questions through the Q&A feature on the control bar at the bottom of your screen. You will also have the ability to see questions submitted by other attendees. This way, if someone has the same or similar question, you can upvote the question. This will allow us to determine which questions are popular amongst the audience. The Q&A feature is separate from the comment section, so be sure to enter any questions to the panel in the Q&A section. Facebook attendees, you can enter your questions in the comment section of the live video. We will monitor those questions and add them to the Q&A in Zoom. It's now time to introduce our panel, beginning with Professor Karla Arenas-Itotia.
Hi there, everyone. So like she said, my name is Karla Arenas-Itotia. I'm an assistant professor of practice for the School of Social Work at the University of Texas at Arlington. Today, I'm going to be talking a little bit more about mental health and domestic violence as it intersects with COVID-19. Some of my background has been in working with victims of violence in higher education and with mental health. I'm happy to be here.
Next, we have Dr. Jandel Crutchfield.
Hey, everyone. I'm Jandel Crutchfield, and I'm thrilled to be here today. I'm also an assistant professor at the University of Texas at Arlington School of Social Work. And my topic today is children and families. And so I have a long history of care and concern for children and families. Obviously, I used to be a kid, right? But also throughout my childhood, throughout my adult years, I've worked with children and families, getting my master's in social work. I've served as a school social worker throughout Louisiana and Mississippi schools before earning my PhD at LSU. And my dissertation work, I studied education interventions. And so currently my research still continues to focus on educational disparities and generally racial disparities in health, economics, and other areas. I currently teach the school social work course as well as a diversity course. And so I'm happy to talk to everybody today.
Thanks. Finally, we have Dr. Rebecca Mauldin.
Hey everyone, it's super great to be here. My name is Rebecca Mauldin, and I'm also an assistant professor here at the School of Social Work at the University of Texas at Arlington. My area of focus is on aging, and my early career was with the Social Security Administration. And as I entered social work and began studying for my PhD, I did a lot of collaborations with public health people. And so I have some background in health as well, and we'll be talking about health and aging today. Most of my research focuses on social connections and how social networks and social participation influences the well-being of older adults. Again, it's great to be here.
Thanks, everyone. To begin, we'd like to provide a few slides of overview. We know that we are facing challenging and uncertain times. The early media coverage related to COVID-19 in January 2020 marked an early sign that the world around us would be changing. Fast forward 5 months, and many of us have sheltered in place, and many of us continue to do so. As of this week, the world has over 9 million confirmed cases of COVID-19 and 473,797 deaths, with the US numbers at just over 2.3 million confirmed cases and about 120,000 deaths. But we are really grappling with the dual pandemics of COVID-19 and structural racism. The combination of the widespread pandemic and its disproportionate effects on people of color, with the protests sparked by the killing of George Floyd, Breonna Taylor, and others, have prompted a reckoning over racism and police brutality. These events have further increased levels of stress and anxiety among people of color from already disproportionately high levels. These mental health challenges also exacerbate the already widespread disparities in underlying health conditions, such as high blood pressure and diabetes, that make COVID-19 even more deadly. The COVID-19 pandemic has made health disparities and the structural discrimination that they are rooted in all the more apparent. When we look at the social determinants of health, such as where a person lives, works, and the quality of healthcare that they have access to, we see that structural racism has left many people of color disadvantaged and marginalized. Research has shown that differences in access to high-quality jobs and economic stability, quality education, healthcare services, and quality neighborhoods contribute to racial inequities in health. Structural racism, which is the policies, programs, and institutional practices that create barriers to the well-being of persons of color, result in unequal access to the health and opportunity promoting social determinants of health that are major drivers of the racial inequities revealed by COVID-19. A long and well-documented history of systematic discrimination against people of color regularly leads to worse underlying health conditions that make it more likely that they may become severely ill during the pandemic and die from COVID-19. Often people think of race as a biological factor in health outcomes, when it's not. Racism, not race, affects health, and race should not be used to explain away disparities caused by racism. There have been calls for urgent action to address the role that structural racism plays in health disparities among people of color and its intersection with the COVID-19 pandemic, which is why we are here presenting on this important topic today. It is imperative that social workers are involved in the response to the pandemic and to structural racism. Each of the panelists will speak more in depth on the issues related to COVID-19, diversity, and health disparities. To begin, I'll begin asking each of the panelists to talk about the context of COVID-19 within their specialty areas. We will begin with Professor K.
Hi, everyone. People do call me Professor K often, so I like the name. So with mental health, I think it's important to acknowledge that mental health is real. We often acknowledge our physical health, and if we notice that something's wrong, we go and we take care of that. But with mental health, it seems to always be something that is considered stigmatized or put on the back burner, right? And so I want to bring a little bit of light to mental health being real. And so while people react very differently to stress and crises, with COVID-19, something that can be expected in ways that people are impacted are the following: fear and worry about your health and the health of your loved ones. We're trying to keep ourselves healthy, and we're trying to keep our loved ones healthy, and that can add quite a bit of stress in everything that we do. For some of us, we may have had COVID-19 and recovered. And if that was the case, there could be a mixed variety of emotions that one can have, from survivor guilt to frustration, anger, sadness. You may even feel stigmatized by the whole circumstance. There are also concerns that one may have about your financial situation, your job, losing your job, loss of support, maybe it's losing hours or changing where you are, from working in an office to working at home, and concerns about, can you pay the bills? Can you pay your mortgage? So all of that can lead to difficulty concentrating, because you're thinking about all of these things and you're feeling the pressure of that impact. Additionally, you may be working from home and you may have a shared space with people. And so that could impact your ability to think clearly and work and do all those things, right? Some other impacts that are pretty common would be changes in eating pattern, difficulty sleeping, changes in sleep, worsening of chronic health problems and mental health conditions that were already there, can definitely be exaggerated by the stress that we are currently experiencing because of the pandemic, and the uses of alcohol and other substances to cope. And so these are typical ways that that stress may manifest itself. Next. And so we also have people who may be more at risk to react strongly to the stress of a crisis, right? So again, going back to people who have lost their jobs and have had major changes to their employment, this is significant. And so this group of people may react stronger to the stress of a crisis. People who have existing mental health conditions, think anxiety, depression, OCD, and so many more, right? That were already there and difficult to manage, but under the current circumstances, it may be difficult to access services, and the stress of the whole situation may actually be impacting that at a bigger scale. We have people with disabilities and developmental delays, people who use a substance abuse, may be experiencing homelessness, people of color, which we'll be talking more about in depth later on, people who don't have access to information in their primary language. We see a lot of English and a lot of Spanish, but are they at the same level of quality, that type of information? We also have an immigrant or refugee population who may not necessarily speak one of those two languages, who may have a hard time navigating what's happening right now and getting all the information that they need regarding COVID-19. That can definitely affect your mental health and stress. People who live in group settings, you may want to socially distance yourself and have very strict boundaries around that. But if you live in a group setting, it could be harder to do that. So that's definitely a group of people who could be feeling that impact of that stress. People who are socially isolated from others. I think all of us can probably agree that in some way, shape, or form, we may feel socially isolated compared to the world before this pandemic. However, there are people who do live alone and in rural areas. So that may affect them even more, right? So I think in general with mental health, this is very real. It's impacting each individual. And so it's important to have some idea of basic signs of what this impact could look like as it relates to COVID-19, and to encourage self-care and reaching out for help should you need it. And so it's very important to know at least one local resource regarding mental health in your area. Thank you. So for domestic violence, on top of everything that I just mentioned, we know domestic violence exists, right? We know that 1 in 4 women have been impacted by relationship violence, sexual assault, stalking, something of the sort. We know that 1 in 10 men have been impacted by that, right? And so this was before the pandemic. And so with the pandemic, victims of violence may be unable to access help due to limited outside social contact. They may not be able to access or seek victim services or shelter as much as they did before. And we know that there were barriers before. Social distancing measures can lead to more in-time in the home or in the space with an abuser, increasing the risk of abuse. So if you're socially distancing yourself or you have a stay-at-home order, but your home is not safe, that can definitely be something that's going to escalate violence, right? And in your ability to safety plan or carry out your safety plan and reach out for help and services if your abuser is always present. I think it's important to also acknowledge that violence within the home is not just an intimate partner violence. It can be child abuse, neglect, it could be elder abuse, right? So paying attention to, I guess, the different facets of what domestic violence can look like is important. Children are especially vulnerable during this time. And I think that has a lot to do with the fact that we don't see our support systems as often, so if kids are not in school, if people are not going to work, you are less likely to be seen by someone. And therefore, if the violence is escalated or there is violence there, people will not see it and therefore may not intervene on your behalf as much as before. Thank you. So some of the things that have been seen by the National Domestic Violence Hotline advocates is that they've been seeing that victims have been saying that abusers have been using the virus as a scare tactic to keep survivors away from their kids or away from families, so to further isolate them, blaming them for, you're trying to infect me, or saying that they'll infect them. They've also been abusers have been using the information to just control, scare, and abuse victims. They have said things like, I'm going to kick you out of the house. They've had hand sanitizers, disinfectants, insurance cards being withheld from them, threatened that the health insurance will be canceled if they don't do what they say. So there's quite a bit of different ways that abusers have actually been using the COVID-19 pandemic to further escalate the abuse that the victim is experiencing. And so I think that with that being said, it's really important to, again, know a resource within your community, a domestic violence agency, a sexual assault agency, that if you need to provide to someone that what that is, and basic understanding of safety plan. Where is it safe? Who's it safe to contact? And maybe having a code word with an individual. And I'll talk a little bit more about that. But I think overall, these kind of sum up some huge challenges within mental health and domestic violence that people are currently experiencing as it intersects with COVID-19. Thank you.
Thanks, Professor K. Next up, we have Professor Mauldin to talk more about her specialty area and COVID-19.
So in terms of aging in COVID-19, older adults' health is disproportionately affected by COVID-19. They experience greater rates of hospitalization and mortality if they're infected. 80% of the reported deaths in our country are of people who are age 65 or older. But really, to get a true understanding of the disease process, we kind of need to look at the complexities of old age. The risks for COVID-19 aren't the same for all older adults. People who have other diseases, people who are in their 80s or above, or living in nursing homes are in the greatest risk factors. While younger people are still at risk. People in their 60s and 70s tend to have much better outcomes than people who are in their 80s and above. Older adults actively contribute to society in many ways. They're beloved family members, but the economic hardships that have been caused by the pandemic, paired with the high risk for older adults, seems to have created a backlash of ageist practices. So for example, we're now seeing discussions about healthcare rationing that devalue older adults' lives. There's suggestions that reopening should exclude older adults, or that the death of older adult may be a reasonable sacrifice for our country to make. So let's look at the next slide. There's so many different ways in which older adults have been affected by COVID-19. So let's just start with people who are still in the workforce. For those who've lost their jobs due to the pandemic, they may be forced into early retirement because it can be very difficult for older people to get hired or rehired when companies prefer to hire younger people. The Social Security Administration is no longer seeing anyone in person and is relying more and more on services online. This is creating a barrier for people who don't have access to the internet. Claims for Social Security are now all being handled by telephone, and we're seeing an increase in fraud where scammers are calling older adults pretending to be taking claims for Social Security in order to get access to their financial information. The healthcare and healthcare access has been so dramatically changed for older adults who are the most frequent users of healthcare. They have been forced to delay crucial health appointments and testing, or to use telemedicine, which yet again requires internet connection. Also, they need, for telemedicine, they need a webcam, and they need to be comfortable with having a virtual interaction. Social isolation and loneliness is a huge concern for older adults, especially in the time of COVID-19. Now, older adults may not be able to have visitors anymore, especially in nursing homes and assisted living facilities. And even in those facilities, they may not be able to interact with each other, depending on the lockdown policies and facility practices. Group activities have been canceled, senior centers are closed. Senior center congregate meal programs have switched to home delivery, which is great because people are still able to get meals. But in addition to meaning that that person may be eating alone now, it also might require them to start cooking regularly because the meals are delivered for the entire week or something like that, or to forgo hot meals. Let's think about older adults with hearing difficulties. They're facing even greater challenges with communication because of mask wearing. This can lead to greater levels of social isolation, and because hearing and social isolation are related to cognitive functioning, we may be looking at an increased risk for dementia. And finally, over 1.5 million people live in nursing homes. In the United States, 25% of the people who have died from COVID-19 lived in a nursing home. In Texas and Arlington, these numbers are even higher. So that is it for my little intro to aging and COVID-19.
Thanks, Professor Mauldin. Next, we have Professor Crutchfield to talk about children and families.
Thank you, Professor Fields, and for Professor K and Professor Mauldin also doing a great job. So when we talk about children and families, think about this. When kids over most of the country went on spring break this year, and pre-K through 12th grade, even through college, they never went back to school. Think about how seismic of a change that is, and you'll immediately know what that physical impact is of COVID to the daily life of millions of children and families. It's completely altered their educational patterns. And so what it's being characterized is as actually a loss. And so children and families are grieving right now. It's the reason why you see multiple virtual ceremonies for graduation, for proms even. You see, former presidents, pop stars, all of these people trying to fill that gap and to console so many children and families in terms of these major milestones that they're grieving the loss of. And so those are major, but there's also the countless other minor milestones, right? Like end of the year parties, like signing day for athletes or yearbook signings, even saying goodbye to, a crush that you had in first grade, right? So the loss of these milestones have placed undue burden on the little minds and hearts of these families, and the families are left to coach them through this. So students who are away from school, who are experiencing this loss, are absorbing all of this, while at the same time witnessing this unprecedented global movement right now for racial justice, right? And some are even leading and participating in this passionate movement. And so in a nutshell, the lives of children in particular and families have been turned upside down in terms of how they interact with school, in terms of the very social fabric, the social contract of their lives. For Sesame Street to have a town hall on COVID-19 and on how to stand up to race and racism, it's a big deal for kids and families. And so since children are not attending school, they're not really participating in sports or clubs, they're not running around the neighborhood with their friends, they're spending their days indoors, and most likely with their parents, their caregivers, other relatives. And so parents, from the family side are now thrown into this role of teacher, friend, playmate, coach, and around the clock, while though still potentially trying to complete their own jobs from home. And so probably a lot of you on this call can relate to these exact situations. For some of us, parents, jobs are deemed essential. So you're not only continuing to show up for work every day, putting yourself at physical risk to try to save lives or provide services, you're also being hit hard by the added responsibility of childcare since daycare centers and facilities are closed. And frankly, a lot of families are overburdened by this, and so they're failing, maybe not for their own lack of capability, but perhaps for the stress and strain or a mental health issue or a lack of financial resources. And so what this has amounted to, and I think Professor K mentioned this too, is that there's this severe increase right now. So beyond the schools closing and kind of that loss, there's this really large increase in severe abuse cases that are showing up at hospitals because nearly all states were shut down, no daycare facilities, after school programs, doctors' offices even had scaled back in terms of who they were going to see. Children were cut off from all the professionals responsible for detecting and reporting suspected maltreatment. So the red flags are not available. And so people are coming in, children are being brought in oftentimes when it's too late. And so the agencies, in the child welfare system are actually confronted with these challenges as well. So keeping children safe despite not having your normal reporting resources, and then navigating how, when, or if investigations can even occur amid social distancing. And I think in 2018 are some of the last numbers where there were about 3.5 million children who either received an investigation or an alternative response, low risk response. And of those, about 700 children actually were deemed to be victims of child maltreatment. And so we understand how important those investigations are. And so right now, just the ability to conduct those is at stake. But they're crucial for social workers to gather information, to make proper judgment about children's safety and their living arrangement. And in order to properly investigate, a social worker usually goes to the home, talks to the parents, talks to the child, other children, doctors, teachers, relatives who have frequent contact. A teacher right now can't see very much through a little tiny window on Zoom while they're teaching the children. So without these kind of thorough investigations, the chances of determining whether abuse has occurred have been greatly diminished. Within foster care systems, similarly, delays and diminished capacity. So we think about visitations with biological parents and children who are supposed to be reunified, having that whole process slowed down, court delays. If you guys are social workers out there, understanding that the process which has already sometimes been typically slow, is even further delayed. So there's permanency plans are delayed for those children and families. And so all of that burden is residing on children, foster parents, families to deal with what's already a stressful situation. And so you have those type of losses, you have those types of delays. The important social interactions are not there. Increased abuse, but there's also just the loss of learning when you're talking about children. There's a reason, right, that there's all of these summer programs in a normal summer, not right now, that say, you know, keep up with your reading or don't forget your math, you know, enroll in this program, summer school, to help you maintain all the things you learn, because there's something called the summer slide where students start to forget some of what they've learned in June and July before they go back to school in August. Well, there's this phenomenon now called the COVID-19 slide, where some students have lost almost up to a year of learning. And as we talk about some of the disadvantages, we know that it affects certain students more. And so when you have students with various learning needs, students who receive special education services, it's hard to offer that content again in a 30-minute virtual meeting. There's really no uniform delivery of education at schools. And so we don't know what that slide is actually going to be like when students return to school. And so one last thing, with children and families, I just want to share that a lot of different special populations within children and families experience all of those things differently. So the existing disparities and inequities have really been highlighted right now during COVID. And so we know that all of these things are true for the children and families dealing with COVID right now, but most specifically, children and families who are living in poverty are greatly affected. And so New York City, for example, was really criticized for taking so long to close down schools. But what they had to grapple with was the fact that so many of their students were considered homeless and got free breakfast and lunch from the school. And so not wanting to stop those services, right? And so right now, amongst those dealing with issues of COVID-19, families and children living below the poverty line are particularly impacted. Children and families who are immigrants who've been negatively impacted by harsh immigration policies are even more in the shadows and not able to necessarily get the services that they need. Youth that are involved in juvenile justice, again, with court delays, this may actually be a delay in justice, literally. Some of them are overexposed to coronavirus by living in facilities, as we heard with some of our elderly population. Children and families who have pre-existing health conditions, including mental health diagnoses or disabilities, are challenged to get treatment. Children have just not been going to doctor's appointments for preventative care. They've not been showing up to therapy appointments. Lastly, youth who identify as LGBTQ+ are actually seeing an increase in suicidal ideation. You know, they're also experiencing an increase in abuse from family members who don't accept them. About a third of them experience parental rejection, and that makes them more likely to commit suicide as a result. And so they've confided in friends, teachers, coaches who are all not available to them right now. And so our children and families are dealing with a lot. And so we'll talk more about specifically how race intersects with these challenges. Thank you.
Well, thanks to each of you for sharing more about the overall impacts of COVID-19 in your specialty areas. We're going to move now to the portion of the panel where we're going to have the panelists talk about the intersection of race and ethnicity with COVID-19. And so to begin, we have Professor K.
Yeah, so I think this is very, very important to talk about. And I'd like to start off that we need to acknowledge that race and ethnic inequality has been very much present and real since day one. And so when we look at the COVID-19 pandemic, it has once again revealed the deep-seated inequities in healthcare for communities of color. So it's amplified social and economic factors that contribute to poor health outcomes. And so what we've seen is that the pandemic has disproportionately impacted communities of color by compounding longstanding racial disparities that were already there. So when the CDC looked at this in April 15, 2020, and I can imagine just how much this has changed, increased, right? But they looked at people who identified as Black, and they saw that while they're 13% of the total US population, they're making up about 30% of COVID-19 cases. Also, hospitalization rates due to COVID-19 are also disproportionately affecting the Black community. Next slide, please. Next slide, please. Okay, so one back, sorry. It just took a little bit on my end to see the change. So overall, people of color are more likely to be uninsured and to lack a usual source of care, which is important to access testing and treatment services. They are more likely to work in the service industry, such as retail, restaurants, hospitality, and are particularly at risk for loss of income during the pandemic. They often, people in this community of people of color often will find themselves working in jobs, like I said, in the service industry, but that are not able to work from home, right? And so that puts you at more risk to contract COVID-19. Using public transportation puts you at more risk to contract COVID-19. They are more likely to live in housing situations such as multi-generational families or low income public housing that makes it difficult to social distance and self-isolate. People of color are at an increased risk for serious illness if they contract COVID-19 due to high rates of underlying health conditions such as diabetes, asthma, hypertension, obesity. We know that there are high suicide rates in the African American community. We also know that 35 African American women, and again, domestic violence can happen to anyone, male, female, of any gender, but we know that 35 African American women are 35% more likely or higher rates of domestic violence than compared to Caucasian women. We also know that African American women are 14 times more likely than other racial groups to be murdered by a man that she knows. So with all of that put together, I think it's important to acknowledge intersectionality, right? If somebody needs help as a victim of domestic violence, can they reach out to the police? I think that that's something that we're seeing right now, very present. As Dr. Crutchfield mentioned, the racial justice movement that is going on currently, that you are seeing in the news and media about the victimization of people of color and police brutality and the fear for safety that one can experience, right? And so is it safe to contact the police? Could be a question. Right? Is it safe to report my abuser that I care about still, but are they going to be treated fairly if I call the police, right? So those are all dilemmas that victims of violence are experiencing, in particular people of color. And so when you put this all together, so you're thinking about the effects that we talked about earlier, the impact of COVID-19 on your mental health, right? And then you're thinking about the inequalities that were there from day one that are now expanded. Then you have domestic violence, which is likely to happen in the home now even more than before. And then to add more to it, you're adding the racial injustice that is currently being highlighted and is happening. Am I safe, right? Am I safe from this disease? Am I safe in my own home? And am I safe outside of my own home? And so all of these things can have detrimental effects to one's mental health. So that's a little bit about race, ethnicity, mental health, domestic violence, and how it all kind of comes together.
Great. Thanks, Professor K. Next, we have Professor Mauldin.
So I just want to acknowledge, I hear that for the Facebook folks, I'm not talking loud enough. So I'm going to try to talk louder. I also have like this super great communications team who's passing along good information like that. So if you still can't hear me, post and they will let me know. So at any rate, I'm going to start talking louder. I do want to talk a little bit before we start talking about COVID-19 in particular. I want to reiterate a little bit about what Professor K was just talking about in terms of health disparities in general. So well before coronavirus, there were huge health disparities based on race and ethnicity that arose from systems that are rooted in and perpetuated by white supremacy. So Professor Fields talked about social determinants of health earlier. These include housing, access to healthy food, education, transportation, income, wealth, healthcare access. These are just some of the many determinants of health. And in every single one of these domains, our systems have disadvantaged people of color, and often by design. So what you see here on the slide is disparities in life expectancies for Black and white people born in the United States all the way back to 1970. And so we can see that white people have longer life expectancies than Black people, and they've had a much steadier trajectory of improvement over time. Now, this graph doesn't show the life expectancy of Latinx people, which typically have been said to be longer than for non-Hispanic white people. But one difficulty with relying on that is that historically the death records haven't always accurately recorded information about ethnicity for Latinx people. So it's a little bit debatable. The one thing also to keep in mind is this graph only tells one part of the story, which is mortality. When we look at health-related quality of life, we see that people of color in the United States have less access to healthcare, including preventive medicine and culturally competent providers. They have higher rates of many chronic conditions and greater death rates from those conditions. They have more environmental exposures as a group. So just on and on, there's so many ways in which health disparities before coronavirus affected people of color in the United States. All right, so now let's talk about coronavirus. The first documented death in the United States was at the end of February. Within a month, we started getting news reports that highlighted the disproportionate number of deaths among Black and Latinx people. But the federal government did not release any data on race and ethnicity until May. So there hasn't been a lot of data analysis yet, but it is nonetheless abundantly clear that there's disparities in rates of infection, hospitalization, and death. So in terms of hospitalizations, a study from the CDC looked at hospitals across the country, and they found that while almost 60% of the residents in the service areas of the hospital were white, they accounted for only 45% of the COVID-19 hospitalizations. Likewise, 18% of the residents in the service areas of these hospitals were Black, but they accounted for a full 33% of the people hospitalized. So now, if you look at this table on the slide, this is about death rates from COVID-19. And it comes from a study by Dr. Mary Bassett and her colleagues at Harvard. They looked at all of the COVID-19 deaths in the United States from February 1st through May 20th and estimated years of potential life lost. And what they did to estimate that was they looked at the age of the person, they looked at the age the person was when that person died, and then they subtracted that from 65. So the years that were lost up until a cutoff of age 65. And then they added up all of that number across all of the people for a particular race or ethnicity group and standardized it per 100,000 people. So if you look at the first line, you'll see that for every 100,000 non-Hispanic white people in the United States, it's estimated that together they lost about 19 years of life due to COVID-19 in those 4 months. The next line shows that for every 100,000 non-Hispanic Black people, they lost 128 years of life. So I just want to take a moment and let that difference sink in. If you look at the rest of the findings, for every 100,000 non-Hispanic, American Indian, or Alaska Native people, it's 75 years of lost life. For non-Hispanic, Asian, or Pacific Islander people, it's 50 years of lost life. And for Hispanic or Latinx people, it's 101 lost years of life. This is in 4 months. And I just want you to think about what this is doing to communities. I will point out that this table doesn't include a category for Middle Eastern or North African people. And this is not uncommon for data in the United States at all. It's a problem because it makes it impossible to track and address disparities for Middle Eastern and North African people. Okay, next slide. So now let's talk a little bit about the intersection of aging, race, ethnicity, and COVID-19. Older adults are diverse in many ways, including race and ethnicity, but also socioeconomic status, disability, sexual orientation, and gender identity. And so addressing marginalization and discrimination in the pandemic needs to include old age, specifically because older adults within marginalized groups are the adults that are most likely to lack resources during the crisis and most likely to rely on healthcare and community service systems. If we go back to Dr. Bassett's research, she's provided evidence that the racial and ethnic disparities in death rates are not as pronounced for older people as they are for younger people, but still compared to older white people, the death rates for older people of color are higher. There's another area where we've begun to have emerging evidence of the effects of the intersection of age and race and ethnicity, and this is related to nursing homes. So we have research from Tamara Konecka out of the University of Chicago, and she's found that nursing homes that have substantial numbers of Black or Latinx residents are twice as likely to be affected by COVID-19 than those that have predominantly white residents. And this finding is not confounded by the quality rating of the nursing homes. It's solely accounted for by the race and ethnicity of the residents. In my opinion, much more research is needed, but some other areas I'd like you to start thinking about where the intersection of race or ethnicity and age may be important in COVID are related to some of the things you've already heard about from Professor Kay and Professor Crutchfield, but reliance on public transportation, housing differences such as living in multifamily or dense housing as opposed to single family housing, having access to technology in order to combat loneliness and social isolation. And then of course, encountering implicit bias of healthcare professionals. Dr. Crutchfield.
Thanks. Yes. Thanks, Professor Mauldin. Now, Professor Crutchfield.
All right, thanks everyone. And a lot of what you all said, Professor Kay and Professor Mauldin, I also wanted to share. So I may cover that stuff briefly, but just try to expound and synthesize in terms of children and families. When I talked about all of the challenges that are facing children and families, loss of learning, loss of connections, increased abuse, family stress, all of these things I mentioned related to children and families. Racism is an underlying cord that strings through all of those challenges. So while all children and families have been impacted by COVID, children and families of color, even within those specific groups I mentioned, like those living in poverty or with disabilities or as LGBTQ plus identities or immigrant status, all of them are facing structural racism in this country that makes it so that Black and brown kids are bearing the brunt of the bad outcomes and are only seeing a sliver of the good ones. So the dual racial justice movement and survival of the COVID pandemic is pushing many of the families to the brink. And so just to think about it, when you think about racial justice, today would have been Tamir Rice's 18th birthday. Right, and he was killed by a police officer when he was 12 years old, playing with a toy gun at a park in Ohio. And so the officer fired with his gun within seconds of getting out of his car. And so as we're dealing with a deadly pandemic, imagine for children and families of color to wake up understanding that very real reality, but to also understand that they could lose their lives just in the process of living their lives. That no matter the thickness of their mask or gloves or how far away they stay from others, that could be an end for them. And so the picture I have here is of 5-year-old Skylar Herbert of Detroit, Michigan. Her parents are first responders. And so at some point in March, she started to complain to her parents that she had a bad headache. She was diagnosed with COVID-19. and later developed meningitis and brain swelling. It was ultimately the first child in Michigan to die of coronavirus. And so I wanted to, as I talked about children and families, and we're talking about death, and we're talking about disproportionality, to make sure that we have a few faces when we talk about the impacts on children. Not just, lack of comfort, loss of this, but actually loss of life for babies. And so when we talk about generally the deaths of Black and Brown people, and talking about our kids as well. And so a lot of this has been said already, but much of the current discussion about racial and ethnic disparities and the risk for illness and death in COVID-19 in the US is focused on social economic conditions that make it more likely that people of color will be exposed to the virus. And I think an equally important and kind of a different question, though, is the attention to why people of color are more likely to need hospitalization and more likely to die, because it's regardless of income, right? Both of those are kind of things that require thoughtful reflection. So we know kind of the statistics that it's happening, but why is it? So part of, from what I'm understanding from the literature and the research there, is that there are higher rates of exposure to the virus, employment and essential services without adequate protection. There's this high profile case of a bus driver complaining that he had to provide transportation for others who were sick getting to the hospital, but not having proper protection himself. Residing in tight quarters, intergenerational families, having hourly wage jobs without paid sick leave, right? So the luxury of saying, well, I'm still going to be paid if I'm working from home is not something that many people of color often enjoy. Other risk factors included. And so these are conditions not just for African Americans, Hispanics, also Native Americans. And so those questions and situations are things that children and families are waking up with and having to grapple with. So I think there's also extensive evidence from the social sciences that have documented how highly interrelated structural inequities are that have led to these types of conditions, and they're sustained through multiple policies, right? And service systems over a long period of time. And this was mentioned both by Professor K and Professor Mauldin. If you think about residential segregation, right? So let's try to visualize this. You have residential segregation that's driven by legal and sometimes financial barriers. The residential segregation then is linked to greater exposure to air pollution and environmental toxins, right? And then that is also coupled with less access to affordable, nutritious food and green spaces for exercise, because we know exercise is a stress reducer. So all of that then results in this complex web of zoning regulations, economic policies, social marginalization. All of this stuff could be changed, but they're so deeply embedded in discriminatory policies and unconscious biases. And these are the things I think that are contributing to many people who are having less access to the high quality healthcare, exacerbated by language barriers too, and higher rates of unequal treatment in the healthcare system. And so I think it's hard, and this I'm wrapping up now, hard to separate the two movements that are happening for racial justice and the crisis that's happening with COVID, because people are seeing these disparate outcomes and they're realizing that there are ways racial justice can address them. Like there's a reason for this stuff happening. It's not just because Black people are not washing their hands, right, as suggested by some, but that's, I think, why we're seeing such an outcry. We're seeing protests, yes, about policing, but I think more about anti-Blackness in all the systems that we're talking about. And that's why you see companies changing policies. You see all of these systemic changes beginning to happen and people calling out for them, because the underlying contributors to those disparate COVID outcomes are linked to the very systemic injustices we see as well. Thanks.
Great, thank you so much. So I'll just remind the panelists, we just have a few minutes left to talk about our takeaway messages and just the main things you want to share related to COVID-19 and diversity and health disparities. So we will begin with Professor K.
Sure. So I just want to basically let people know, you know, people react differently to trauma, and the way that you react is okay, right? You know, some people take to humor, some people may cry, some people may be sad, and some people may feel numb, right? So whatever your reaction to trauma is, don't be harsh on yourself. Trauma is called trauma for a reason, and so don't judge yourself too harshly. It's okay. But we need to practice self-care. So emphasizing to take care of yourself. What do you need to do to take care of yourself, to feel safe, to feel cared for? Is it limiting social media for time periods? Is it watching the news only at night or only in the morning, so that you don't get the stress of all of it, of all the information that you are taking in at that moment? Is it maybe reading a book, relaxing, being kind to yourself, and giving yourself permission to not be perfect, right? Whatever that is, just make sure to keep that on your forefront. Also, community care. I think it's very important to think about that we all have a role to play in order to keep each other safe and healthy, right? And so I think COVID-19 is showing that with mask wearing, washing your hands, socially distancing, right? But there's also a level of community care that comes from acknowledging and validating experiences of individuals, racial inequalities. Just because it isn't your truth, it isn't your story, doesn't mean it's not real and it isn't someone else's. And so that is a version of caring for others, by listening and validating each other, and being anti-racist, right? And it's not enough to just say, I'm not racist. No, we need to be active participants in being anti-racist at the micro and macro level. You know, and knowing when to step in and fact checking, right? We get a lot of information. It's very important to know that the information that you have is the most accurate information for you and your family, and for evidence-based practice of whatever it is, an area that you're working in. And so bystander intervention is just being able to do something, or if you see something, say something or do something, right? That could be as simple as, oh my gosh, I haven't heard of my friend for a while. Oh, or wow, there is a lot going on. I may want to check in with my friend or my colleague or my family member. And maybe it's a phone call, maybe it's a text message, maybe it's FaceTime, whatever that may be. But being able to show people that you care and check on them. You never know what you're going to find. It could be that someone is struggling with their mental health or depression, or struggling with what is going on right now in this racial justice movement, and are being impacted by these things. And so it's important to reach out. It's important to know about safety planning and to keep each other safe, right? If you have a friend or someone that you know is experiencing domestic violence within their home, you know, it's important to know a resource. It's important to be able to have a general idea of like, oh my gosh, what can I do to help you and keep you safer? Remember, people may not want to call the police in a circumstance like this of COVID-19, and with the acknowledgement of racial inequalities. So what are some simple things that informal supports can offer, such as you can text me, you can give me a call, you can have a code word, make sure to be in a safer space within your house, and things like that. And that could be a whole lecture on its own, but and then knowing your resources, know what's around you. Again, if there are formal resources out there, and we are informal resources as well that we can be to others, but knowing a resource is very important. If you are experiencing something that you need help, whether it's domestic violence or mental health, or in any of the other areas that were mentioned by the other professors here on this call, you know, you need to know at least one resource. You can't help someone if you don't know what direction to point them in, right? And so some basic resources, I think, is just to know a domestic violence agency local to you, and know a mental health provider local to you. So should someone need it, and hopefully they don't, but if they do, you know where to point them to. Thank you.
So from the perspective of aging and health, the takeaways I have for you are: first, health disparities are not new. And yet we see COVID-19 as this new context, which is exacerbating and highlighting the health disparities, and in just such a brutal and devastating way. Older adults may be at higher risk for COVID-19, but that doesn't change that they're important members of our society, our community, and our families. And yet their lives and their health are greatly affected by COVID-19. And last but not least, I'd like to amplify Professor Crutchfield's voice from the last slide and also from private conversation that we had yesterday. Black Lives Matter doesn't just apply to police brutality. We're in this context where coronavirus is just yet another of many, many contexts in which we need to acknowledge and act on the fact that Black Lives Matter. Thanks.
Great. Thank you so much, Professor King, Professor Mauldin. Good job. So thinking about kids and some of the major takeaways, the longstanding issues of racism, as we've talked about, underlie all of the outcomes really that we're seeing for kids right now. And I think it's important, we know what intersectionality means, and I think each of us has mentioned it, but people, I think, often diminish the importance of intersectionality when it comes to kids. And so I want us to take away that we should not do that. We should caution against it, right? So people are often, oh, kids are kids. All kids are the same. All kids like to eat. All kids like to sleep. All kids like to play. And so we need to turn that on its head to understand particularly the outcomes for kids with all type of special categories of needs, but brown and Black kids in particular who are being failed by systems. We need to make sure that we do get and apply intersectionality when it comes to kids. So the takeaway for children and families in that regard is to understand the systemic nature of racial identity across all other identities. And then school reentry is a big concern for everybody, right? If anybody on this call has kids, what are we doing about school? We don't know. Many people will be okay, but there are so many children who for them, school reentry, if it happens, has the potential to be chaotic. And really just because of the sheer practicality of physically re-entering school safely. But also because of the enormous emotional toll faced by children and families while they've been away. And so actually the NASW Texas chapter has a letter going around that is suggesting a mandatory debriefing period for students and staff once school opens. We can't act like there hasn't been 6 months of, turmoil for kids and staff and families. And so what that should look like, I think, is something we as social workers can lead on in terms of addressing school norms. What are your norms supposed to be for children who've been out of school for so long? Because we know that can lead to disproportionate discipline outcomes, right? If we're not understanding and advocating for students who, hey, I kind of forgot how to be in school, and that's not really my fault. So our attention to equity is really going to be important in school reentry and the strategies there. And then lastly, and similarly for practice with children and families going forward, is just really assessing how the learning loss and the immediate physical needs and potential anxiety of reintegration in whatever system they're in, whether that's school or whether that's returning to court for a child welfare hearing, returning to doctor's offices or to sports, all of those things that children may not be able to express and families may not be able to help them through. I think that's the perfect opportunity for our profession to step up and to be leaders in making sure that we elevate those needs of children and families. So thank you.
Well, Professor K actually put together a couple great slides on resources. In the interest of time, we won't go through those, but we will be able to share our PowerPoint with anyone who is interested after the presentation and later this week. So we do have some resources listed here. And I think it's good that we move to our Q&A, almost right on time. But I just wanted to remind you of a couple things. So If you're on Zoom, you can enter your questions through the Q&A feature on the control bar at the bottom of your screen, and you have the ability to see questions submitted by other attendees. And so if you have the same or similar question, just go ahead and upvote the question. Please note that that Q&A feature is separate from the comment section, so be sure to enter any questions to the panel in the Q&A section. And of course, Facebook attendees, we're so glad you're here. You can enter your questions in the comment section of the live video, and they will be added to the Q&A. So I'm going to stop sharing. And do my best on our Q&A. So our first question is, how is COVID-19 affecting pregnant women and their families with a focus on mental health and fetal outcomes?
Well, I think that's probably a really good question for myself and Dr. Crutchfield, but I think I can speak to what I know within domestic violence. We know, and also with stress, right? We know that stress impacts the mother and impacts the fetus, right? And so it can leave long-lasting detrimental effects on a pregnancy and the child, right? We also know that when it comes to domestic violence, women who are pregnant are at higher risk for domestic violence and for violence to escalate. And so I think we as a profession, but as a healthcare, we just need to be more aware that pregnant women are at higher risk of a lot of things, right? It's already a struggle to be pregnant for some, and I know it was for me when I had my son. I dealt with a lot physically and emotionally and mentally when I was pregnant, and so you add in COVID-19, you add the effects of how that's going to affect your mental health and your health, and then how that translates because the mother and the child are connected. So how that impacts the fetus, and we need to provide a lot more support for pregnant women during this time, I feel. Dr. Crutchfield, I don't know if you wanted to add to anything.
No, I think you covered it well. I would just kind of reiterate that we know pregnant women, we know children, their parents are not necessarily taking them to doctors. And so we've, had a history potentially of people who have less access to having doctor's appointments, not going. And so we know that that's even exacerbated as people are worried about, potentially contracting this virus. And so I know that would have an impact as well on fetal outcomes.
Great. I'd like to jump in just a little bit about the postpartum, which isn't exactly answering your question, but social isolation and lack of social support, economic worries are all huge risk factors for postpartum depression. And I feel that that's an area that's also really important to consider, and to find ways where we can, some of the ways in which mothers had an opportunity to at least check in with a healthcare professional postpartum were because of the well baby checks. But now some of these are being pushed back, and okay, we're not going to do our first round of vaccinations immediately, we'll wait. And so I just think this is an area of concern that as a profession, we should also be considering.
I would like to add one more thing also. Now that you brought up postpartum, I think that was great. Because the delivery, it's not just about the pregnancy, but the delivery itself. Many women are concerned about who they can even take into the hospital, and not being able to have someone there for support. And maybe people, a lot of people of color and minority groups, they have a larger extended idea of what the nuclear family is. And so when you think about the birthing process and the care of a newborn, and even during the pregnancy, it heavily relies on other people. And so not being able to have those supports present, I think are definitely affecting minority groups a bit more than others.
Great, thank you, panelists. We have another question that is asking, what is being done to support domestic violence victims with perpetrators using COVID against them? And how can we better support victims in these situations?
Well, what I have seen is, one, I know that a lot of domestic violence agencies automatically provide a lot of free services. So these services are all free. That is a misconception that I think a lot of people have is, oh, well, what if they ask me to pay? And so many of these are nonprofits and will provide free support, or in some cases, they may ask for a minimal cost, right? So one thing that I have noticed is that people are providing virtual services, just much like telehealth, right? And so that they're able to contact domestic violence agencies virtually, not just through the chat that they usually have on their website, but being able to schedule case management appointments and counseling appointments virtually as well to support victims of abuse. But I think there are dilemmas to all of this. Imagine you being in the same home with your abuser and you're trying to contact, services. Can you really speak out? Can you even have that happen within within the space that you're in? I also believe that some places are still offering to come in. I know that shelters are fully operational with struggles, right? They have struggles. They're trying to maintain the health and well-being of all of their shelter residents. But, this comes with cost. This comes with a lot of extra effort. And so I think we, as a community, we need to be supporting nonprofits and organizations like this. I know that several local ones are reaching out for help. They're saying, in order to support victims of violence, we need financial support, we need volunteers, we need this and that, and they're considered essential. So they're open, they're still providing services, but how they do that might have changed a bit. But they're still available.
We have another question. I have seen a lot of frustration within non-Black spaces on the requirement of masks. Do you feel this is connected to the amount of people affected within those communities?
When I was working on my slides and I saw the number of years of life lost in each community, it hit me so hard. It just feels like such a devastating way that a number can portray what's happening in reality. And I just had this clarity that wearing a mask can be an action we take for racial justice. And that when we wear a mask, we're protecting people in the community. And so for people in the white community who may not have been as directly affected by COVID-19, yes, it's a racial justice issue. So I don't remember exactly how the question was worded, and I don't presume to know what's in people's minds when they do or don't wear a mask, but I would just encourage that we, certainly in the white community, I would encourage my white brothers and sisters to wear a mask. It protects everyone.
Yeah, and I think Melanie's question was also kind of just saying, is that related to, right? So I'm sure Professor Mauldin, people aren't walking around with those specific numbers in their head, but that concept is given through our media, right? Like it's oversaturation with, we know who's affected by this. So guess what? I'm not concerned because of anti-Blackness in our society, right? And so it's a problem that's affecting them. It's not really as a concern for me. So why do I have to be inconvenienced, right? If you think about the larger issue, even of policing, right? People not being able to look at the perspectives of others and validate that there is actually a concern within other communities. So I definitely think it's related, kind of that pushback against wearing masks.
Thank y'all. The next question is, how is COVID-19 affecting families with loved ones in mental health facilities or group homes? Oops, sorry, it went up. Or group homes. I don't know what happened to it. it
I'm
disappeared.
sorry. If you go to the dismissed at the top,
Uh-huh.
you should be able to see it. I apologize.
Oh, okay. Sorry. Okay. How is COVID-19 affecting families with loved ones in mental health facilities or group homes to where they are shut down to prevent the spread of the virus?
I can say that I think nursing homes and different facilities are taking steps and precautions to people coming in and out, which I think is a way to protect those who are living there or temporarily staying in a facility. So things from checking your temperature to obviously wearing masks, and some people in the health facilities use gloves effectively. I'm not saying that everyone does. Clearly that has been very controversial, but taking basic steps like this, limiting how many people come in at one time and encouraging space between individuals within those facilities are helping manage the situation. But at the same time, I think it's problematic for people not to be able to see their loved ones. So I would consider these individuals to be more isolated than other people. I mentioned that in my portion, where we all feel isolated, but there are some who are more isolated than others, right? And so if you're in a nursing home, a group home of some sort, it's likely that other people are making those decisions for you of rules and regulations of who can come in and who can't and how it's done. And do you have technology to be able to talk to other people outside of that or not? And so I think that there are ways that people or things that are putting in place to protect people and to sort of manage that. But at the same time, it can hurt people's mental health, right? Not to be able to be connected with others. I don't know if Dr. Mauldin has anything else.
Well, I can't really speak to mental health facilities and group homes, but I can definitely address nursing homes. And I would say that it's been tremendously hard on families. Some family members have been presented with a decision that had to be made within days of, are you going to leave your loved one in this facility and not be able to contact them? Or are you taking them home now? Because you need to decide and you need to come and get them tomorrow or whatever that is. Incredibly difficult decisions that people are having to make while they're juggling, potentially working from home, having lost their job, having childcare at home. The other thing, and this is not necessarily related to how family members are coping, but I just saw an article in the New York Times, I think yesterday or maybe the day before, where nursing homes are getting, because of the CARES Act, they're getting higher levels of reimbursement for people who have COVID-19. And some unethical nursing homes are actually putting people out on the streets in order to make room for the more profitable beds. Yeah. So that's obviously a major issue of concern.
Thank y'all. Our next question is, how can social workers and counselors support our clients and patients during these hard times when resources are limited, especially for minority clients?
I think validation is important, particularly when you talk about clients of color in situations like we just talked about with masks, where there seems to be this push to move on, as if your life and your struggles aren't as important. We're ready to move on and not be dealing with that. So to continue to validate for them that yes, these are struggles, and like I mentioned, that may be there for the foreseeable future when kids return to school, long after we get a vaccine, because of the structural inequities that need to be challenged. And so I particularly resonate with what you're saying about the lack of resources. And so, what I could say about that is that, as social workers, we can enjoin causes to make more resources available, right? So advocacy is a lot of the part of the work that we do. And so we know where things are being cut or where, there might be corruption, like Dr. Mauldin talked about. And so putting pressure on elected officials to make sure that clients are still receiving some of the services that they possibly can.
All right,
Thank you.
I just wanted to let you guys know we have one more question from the chat, and then there's a few questions from Facebook.
Okay. Question from the chat, I'm not sure.
The question from the chat is, what specific actions can higher ed, respective of past history, start doing with purpose and intent to start addressing the issues and disparities you discussed?
Well, I think it's focusing on wellness is very important. In higher education, you will, well, a lot of people may think, okay, I'm going to school and that's it, I'm going to get a diploma. But the reality is that when you come to a university or a community college setting, anywhere where there's higher education, it usually is like a community. It's like a little town within a town, right? It has health services, it has mental health services, it has other wellness services such as violence prevention, gender centers, and so on. And so while the education is important, I think highlighting programs that are focused on wellness is super important. It helps identify and address issues that students are experiencing outside of just their education. It's things that are affecting them, psychosocial stressors affecting them on a daily that they, we ask them not to bring to school, but they are, because it's a part of their life experience. And so if we can provide attention to supportive services on campus that are addressing all of these inequalities that we've talked about, we are going to help a significant portion of students, students of color, be able to make it to the end, right? To be able to graduate. We were able to retain them. We're able to promote student success. And so putting an emphasis, I think, on wellness, supportive service, and resources on campus is crucial. But I think also it's for a university and a higher education entity to acknowledge them first, right? You have to acknowledge that racial inequalities are real in order to be able to see the need and those and the need of these students and be able to provide for those students. So I would say acknowledgement, and then be able to provide the infrastructure to address these inequalities from a wellness perspective for students is crucial. And from an academic perspective, in which you have what you need and the infrastructure that you need to provide a different type of learning for different types of needs.
Yeah. Professor K, I love what you said about like a town within a town, right, and support services, but a town also has policies, right? And so higher ed, I think lots of higher ed institutions are having kind of a reckoning and saying, what have we been complicit in, perpetuating white supremacy or oppressing our students, whether it's their academic outcomes, their social outcomes. What are our relationships with our local police departments, right? With several universities severing ties with local police departments because of the adverse impact on their students. And so I think having the right people in the room, obviously meaning people of color, people from diverse backgrounds, to have conversations about policy change is crucial, and then having the courage to be able to change those policies in a way that actually positively impacts the university and students. And that also means grappling with history and having those honest conversations about things that need to be highlighted, things that need to be changed.
I agree with both of you very much. And I'd like to just say, I love this question because it's a question that's putting responsibility on a system, and a system that has been involved in white supremacy, helps perpetuate white supremacy. And we talk a lot about where's the onus on making all of these changes. And for so long, it's been people of color, Black and brown people, who've been saying, look at this injustice. And so for the systems that have been rooted in that, for white people to stand up and say, we too see this as a problem and an issue. So I love that the question is even looking at the higher education as a system, and as a system that has been involved in creating and perpetuating some of these disparities. One thing I could say is, just for some context, people who like to tweet can follow the hashtag Black in the Ivory or Black at UTA and see some things that have happened here on campus. Our student government is suggesting that we have a mandatory class for all, I don't know if it's incoming freshmen, but if you're going to graduate from UTA, you need to take a class on dismantling oppression. And so that's a policy, like Professor Crutchfield was saying, that potentially a university could look at. You can also, in many ways, it comes from the top down. What are our department heads? What is our administration saying? And what are we expecting for white people in this space to do and behave, and how to act and how to interact, and what is just absolutely not acceptable. One of the Black at UTA hashtag posts that I read was a Black student was going for advising and was interested in med school and was told, well, you probably don't want that. People like you probably don't need to go into medicine. And that's the kind of thing that the university needs to know about and to make absolutely unacceptable. We need to do everything that we can to dismantle these systems that have been in place for way too long.
Great. Thank you all so much. In the interest of time, I'm going to ask one last question, which I think is a nice closing before we actually have our conclusion. So we have a couple announcements at the end. And the final question is, there were large health inequalities before the pandemic. Will the pandemic make those differences even larger? Can anything be done to address these growing disparities?
Well, yes, I think absolutely. They are already there. They were there before, and now they're even larger, right? I think we've all kind of touched on that in the entire presentation, that, we had these issues before, they're only getting worse, right? And that's why I think the stress is happening of compounding all of this information together. And then, you're seeing movements, protests, lots of information and lots of advocacy out there. It's because these things are getting bigger, right? And so I don't want to steal Dr. Fields' thunder, but we will be having another presentation. So it's a 3-part series, and I'm sure she'll talk about that more. That will be addressing more on what can we do about what we just learned about today, right?
So again, not to steal the thunder of panel number 2, but I would just encourage looking at the different social determinants of health. And we mentioned lots and lots of them. And sometimes it can get overwhelming to think we can't change everything, but maybe where is your passion? Is your passion in housing or transportation or healthcare access, or having health materials available in languages that people can understand, and so on? There's so many different ways. And so even just a quick Google of what are the social determinants of health, find one that interests you, Google that. There's so much education that you can do on particular areas where there's opportunity to make a difference.
And I know we have 1 minute, so just don't let it be a passing concern, right? Structural change is going to take a long, concerted effort by all of us. And so long after things have appeared to go back to normal, normal is not good for so many people in this country. And so make this a sustaining effort.
Great, thank y'all. I'm going to share my screen for the last couple slides, if I can do it. Did it? So just in conclusion, thanks everyone for attending today's panel. Thanks for the great questions. Thanks for your participation on Facebook as well as Zoom. Please save the date for the second panel that has been mentioned. It's going to be titled COVID-19, Diversity in Social Work Practice. It's going to be July 10th at 2 p.m. again on Zoom webinar and Facebook Live. More details are to come, so please follow our social media at UT Arlington School of Social Work. And also, there's another event happening Tuesday at noon It's called Celebrate Pride, a discussion of the intersections of race, social justice, and LGBTQ plus identities in the time of COVID-19, which is also sponsored by the School of Social Work. The speakers will be UTA faculty and students and LGBTQ plus community representatives. It will be also held on Zoom webinar and the Facebook Live feature on Tuesday, June 30th, noon to 1:30 p.m. And our last slide is just the contact information of the panelists. I know there was a few questions about getting copies of the presentation. I believe they will be emailed out, as well as to folks who are interested. Please reach out to the special events folks at the UTA School of Social Work, unless Ms. Coral, you want to announce other ways that they can get access to today's materials.
Yeah, sure. So if you would like an email copy of the presentation, you can shoot me an email. The email address is ssw specialevents@uta.edu. Again, that's ssw specialevents@uta.edu. Send me your email information requesting the PowerPoint, and I will send that information out.
Thanks, everyone. Please reach out for further questions from our panelists, and we hope to see you all at the second panel on July 10th.
Hi, everybody.